and welcome to A Sound Constitution here on CHLY 101.7 FM, a show where we focus on health topics that are important to our community. This year's team is made up of 6 third-year VIU nursing students. Our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable resources. All information provided on our show will be available in our show notes on our Facebook and Instagram pages. We want to remind our listeners that the information presented in this show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, Instagram at CHLY A Sound Constitution, all one word, Spotify at A Sound Constitution, or email us at asoundconstitution@gmail.com. Thank you for tuning in. We look forward to sharing health information with our listeners.
We begin today by acknowledging that we are gathered on the unceded and traditional lands of the Nanaimo people, whose rich cultural history continues to inspire and guide us. Our broadcast also extends into the territories of the Coatsan and the Sliaman nations. We are deeply thankful for the Nanaimo people's enduring connection to this land and for the opportunity to live, learn, and work here today. We make this acknowledgement with a commitment to honor and respect Indigenous cultures, traditions, and histories, and to actively participate in the ongoing work of truth and reconciliation. For more information on the ongoing reconciliation work and land acknowledgement practices of the Nanaimo people, we invite you to visit our Facebook, Instagram, and YouTube pages.
Welcome back to A Sound Constitution here on CHLY 101.7 FM. I'm Madison, your host for today's episode on information that affects us all, sexual and reproductive health. From STBBIs to essential healthcare access, we're diving deep into issues that matter in our community. In the first part of today's episode, my co-host Rebecca will share facts with you should know regarding sexually transmitted infections. With reports showing a steady increase in STI rates, especially among young adults, Rebecca will discuss how sexual health clinics play a crucial role in providing services to those who might not have access to other healthcare options. But we won't stop there. This conversation expands beyond just prevention. We'll also touch on how conditions like endometriosis and PCOS impact reproductive health, often causing years of undiagnosed pain and health complications. We'll talk about the barriers people face in receiving proper care and why ensuring everyone has the information and resources they need to make informed, empowered decisions about their health is important. After that, we're in for a special treat. I'll be joined by Anita Carroll, a registered nurse supervisor at Nanaimo's Options for Sexual Health Clinic, who will provide even more insights into the services offered in our community. From STI prevention and contraception to sexual health resources, Anita will highlight how clinics like Options help bridge the gap for individuals who might otherwise face challenges accessing care. Later on, Anna, my co-host, will be back with an exciting update about a new at-home cervical cancer screening program available in BC. This game-changing initiative removes barriers to screening, allowing people to check for HPV and catch early signs of cervical cancer, all from the comfort of their own home. To end the episode, we'll provide our listeners with a detailed list of resources for accessible sexual healthcare. So whether you're tuning in to stay informed, ask questions, or get motivated to take control of your health, you're in the right place. Join us as we tackle these important topics and continue working together to create a healthier, more empowered community. This is A Sound Constitution. Welcome to our journey on the importance of sexual health information. Once again, I'm Madison, joined by my co-hosts Anna and Rebecca. Let's begin to travel down our path by following Rebecca. Over to you, Rebecca.
Hi, everyone. My name's Rebecca. I'm one of your hosts today. We want to take a moment to acknowledge the language we use when discussing sexual health. Throughout this episode, we refer to STIs, sexually transmitted infections, but we also recognize that STBBIs, or sexually transmitted and blood-borne infections, is a more inclusive term. STBBI covers infections like hepatitis that may not be sexually transmitted but are still relevant to testing and prevention. Language evolves, and staying up to date helps make conversations more inclusive and accessible. While we will be using STI and STBBI interchangeably, we want to highlight the importance of using the most up-to-date terms that reduce stigma and promote understanding. Let's talk about the recent rise in STI cases, especially here in Nanaimo, BC, and we want to give you the facts you need to stay safe and healthy. But beyond that, we're going to talk about why accessible healthcare, including education about conditions like endometriosis and PCOS, contraception, menstruation, and STIs, is so important. Because when people have the right information and care, they can make choices that keep them healthy and empowered. Sexual and reproductive health is more than just preventing infections or unintended pregnancies. It's about ensuring people have access to comprehensive healthcare that allows them to live full and healthy lives. Yet there are significant barriers to this. Many people, especially young adults and marginalized communities, face difficulties in accessing sexual health services due to cost, lack of resources, and stigma surrounding these topics. According to the BC Centre for Disease Control, syphilis rates have increased in certain regions, highlighting the need for accessible STI, sexually transmitted infection, testing and treatment. The Options for Sexual Health Clinic in Nanaimo serves approximately 1,500 to 2,000 patients annually, with over half of them lacking access to other healthcare providers.
Although the clinic has received a year of funding, it remains at risk of closing once the funding period ends.
STI rates could rise even further, disproportionately affecting young adults who may not have alternative healthcare options. Furthermore, the Public Health Agency of Canada reported that in 2023, rates of chlamydia, gonorrhea, and syphilis continued to climb, with chlamydia remaining the most frequently reported STI. Globally, the World Health Organization estimates that more than 1 million STIs are acquired every day, underscoring the urgent need for widespread education and access to care. So, what exactly are STIs? STI stands for sexually transmitted infection, and as the name suggests, these infections are passed primarily through sexual contact. STIs are actually extremely common, and anyone who is sexually active can get one, regardless of gender, age, or sexual orientation. STIs can be caused by three main types of organisms: bacteria, viruses, and parasites. Some STIs are curable, meaning they can be treated and completely eliminated with medication, while others are manageable, meaning they can't be cured but can be controlled with treatment. Some of the most common types of STIs include chlamydia and gonorrhea, which are bacterial infections that can be treated with antibiotics; syphilis, another bacterial infection, but if left untreated, it can cause serious health problems; HPV, human papillomavirus, a viral infection. Some strains cause genital warts, while others are linked to cervical cancer; herpes, a viral infection that causes cold sores or genital sores; HIV, human immunodeficiency virus, a virus that affects the immune system, but treatment can help manage it. How do you get an STI? STIs spread through different types of sexual and intimate contact. Many people assume that only penetrative sex can transmit an STI, but that's not true. Here are the main ways they are spread: vaginal, anal, and oral sex. The most common ways STIs are transmitted is through sexual contact directly. Bacteria and viruses can spread through bodily fluids like semen, vaginal secretions, and blood. Another form is skin-to-skin contact. Some STIs, like herpes and HPV, can be spread even if no fluids are exchanged. This means that even close contact without penetration can transmit infections. Sharing sex toys. If sex toys aren't properly cleaned before uses, infections can be passed between partners. Blood contact. Certain infections like HIV and syphilis can be transmitted through blood-to-blood contact, such as sharing needles. Childbirth and breastfeeding. Some STIs like HIV and syphilis can be passed from a pregnant person to their baby during pregnancy, delivery, or breastfeeding. One of the biggest misconceptions about STIs is that you would know if you had one, but many STIs don't cause symptoms right away or at all. This means a person can have an STI for months or even years without realizing it, which increases the risk of passing it on to others. For example, chlamydia and gonorrhea can be completely symptomless in some people, but still lead to serious health issues like infertility if left untreated. Similarly, herpes can even be passed when no visible sores are present. So how can you protect yourself? Use condoms and dental dams. Get tested regularly. Communicate with your partner. And consider vaccines, like the HPV vaccine. Beyond sexually transmitted infections, reproductive health conditions like endometriosis and PCOS, polycystic ovarian syndrome, significantly impact the lives of many people with uteruses. According to the Endometriosis Network Canada, it takes an average of 5 to 7 years for someone to receive a proper diagnosis due to medical dismissiveness and lack of awareness. This is a serious issue because endometriosis causes chronic pain, infertility, and other health complications, yet many people go undiagnosed or untreated due to a lack of awareness and medical misinformation. So what exactly are these conditions? PCOS, polycystic ovarian syndrome, is like your body's hormones being a bit out of balance. People with PCOS may have irregular periods, more body hair, acne, or trouble getting pregnant. It can also make it harder for the body to use sugar properly, which can lead to health issues such as diabetes. Endometriosis is when the tissue that's supposed to grow inside the uterus starts growing in the wrong places, like on the outside of the uterus, ovaries, or fallopian tubes. This can cause really painful periods, heavy bleeding, and even make it difficult to have children. The pain can be so bad that it affects daily life, but since it's not always well understood, people often go years without proper diagnosis or treatment. Similarly, PCOS affects up to 10% of reproductive age individuals and is one of the leading causes of infertility as per PCOS Awareness Association 2023. It is linked to higher risk of diabetes, heart disease, and mental health struggles, yet many healthcare providers fail to properly diagnose or educate patients about this condition. Without accessible reproductive health education, people may suffer for years without understanding their symptoms or receiving proper treatment. So why does contraception access matter? Access to contraception is another critical aspect of reproductive health care. The Guttmacher Institute 2023 reports that access to birth control reduces unintended pregnancies and improves economic and educational opportunities for people who can become pregnant. However, barriers to contraception remain particularly for young people, low-income individuals, and those in rural areas. In Canada, while contraception is covered for some individuals, many still struggle with affordability and access to the method that works best for them. Additionally, contraception is not just about preventing pregnancy. It is also used to treat conditions like endometriosis and polycystic ovarian syndrome. Hormonal birth control can help manage painful periods, reduce ovarian cysts, and balance hormones. Yet misinformation and stigma surrounding contraception make it harder for people to seek care. Unfortunately, limited funding for clinics like Options for Sexual Health means that affordable contraception may become harder to access, creating barriers for those who need it most. According to a 2022 report from the Action Canada for Sexual Health and Rights, access to reproductive health care remains inconsistent across provinces, with some regions having fewer clinics and longer wait times for services. The rise of sexually transmitted infections and the importance of getting tested. Sexually transmitted infection rates are also impacted by stigma and lack of education. Many people avoid testing due to fear or misinformation. However, as smartsexresource.com points out, STI testing is free, confidential, and an essential part of maintaining sexual health. Chlamydia and gonorrhea rates remain high among young adults, making regular testing and open conversations about sexual health even more critical. So, why are STI rates rising? Experts suggest that misinformation, reduced condom use, and decreased funding for sexual health education contribute to the issue. The Public Health Agency of Canada reported that STI rates have been increasing steadily over the past decade, with chlamydia remaining the most commonly reported sexually transmitted infection. So, what can you do? Use protection. Condoms and dental dams significantly reduce STI transmission. Get vaccinated. The HPV vaccine prevents cervical cancer and genital warts. Get tested regularly. Many STIs have no symptoms, making routine screenings essential. Know your rights. Sexual and reproductive health care is a fundamental right, and advocating for continued funding of clinics ensures that these services remain available. And lastly, talk about it. Open conversations about STIs, contraception, and reproductive health help reduce stigma and encourage responsible health decisions. It's time to break the stigma surrounding sexual and reproductive health. Seeking care for STIs, using contraception, and discussing menstrual and hormonal health are all normal and necessary parts of maintaining overall well-being. If we continue to push for open, honest discussions, we can create a culture where people feel empowered to seek the care they need without shame or fear. If you or someone you know needs access to resources, please check out Options for Sexual Health at optionsbc.org, Island Health Sexual Health Services, smartsexresource.com, the Endometriosis Network of Canada, the Polycystic Ovarian Syndrome Awareness Association, and Action Canada for Sexual Health and Rights. Stay tuned for when Madison interviews Anita Carroll, a registered nurse working at the Options for Sexual Health Clinic right here in Nanaimo.
Thanks, Rebecca. I'm here with Anita. Anita, thank you so much again for joining us, especially considering your very busy schedule. My goal in interviewing you today is to have our listeners more informed on sexual and reproductive health resources in our community. Are you ready to jump in?
Sounds good, Madison. Thanks for asking me to be a part of this. It's always nice to work with students to teach more about sexual health, so thank you.
Awesome. So we'll start off with an icebreaker, and can you tell our listeners a little bit about yourself?
Yes, so I am obviously a nurse and I'm an instructor, and I'd like to acknowledge that I live on the beautiful lands of the Quamaton Village down in Cowichan Territory, and I've actually lived here since the late 1980s, so it's a beautiful place to be, and so grateful to be living here and bringing my children up in this beautiful land. I actually was a nursing took my nursing program as a diploma way back when this university used to be called Massapequa College. So I've been a nurse for a little bit here, 3 decades. It's kind of crazy. My passions are community health nursing. That's the only reason I got into being a nurse, was to be a public health nurse and working in our communities to make healthy communities. And I have a passion for sexual health, which is why you have me here today. And I've had the luxury and privilege to work with several Indigenous communities in the Central Vancouver Island area and the territories, from Malahat, Cowichan, Nunavut, Nanaimo, and Sinimus, and working at Planned Parenthood in the late 1970s, pardon me, the late 1990s. 70s is when I was born. And it was Planned Parenthood. And then years later, it was changed to Options for Sexual Health. So I'm still involved with that agency.
Thank you so much for sharing. It's very clear that you bring a lot of passion and experience to your work. Speaking of Options for Sexual Health, could you provide the listeners with an overview of Options for Sexual Health and their mission?
Absolutely. So we are, if you look at our website, it says we're the champion of sexual health for people in BC. So we offer confidential, non-judgmental care. And I guess since sex positivity is the best way to look at it for anybody who comes into us. It doesn't matter what your sexual preferences are, where you are in your gender of sexuality. We look after everybody and give the care that people need. And we are a social basically nonprofit, and we have a charity status, and that's how we do a lot of fundraising. We look for grants and ways to support this agency that we've been doing. And the one in Nanaimo has been in Nanaimo for over 50 years. I think we're almost 55 years in Nanaimo now. So we've been around for a long time, doing a lot of work to help people in our communities. And if you remember back to Nursing 302, when my colleague and I were talking about intersectionality, that's, I guess, is a great word to use to describe what we do at Options for Sexual Health. We work with a lot of members of society who may be marginalized, who may have judgments and may not feel comfortable actually going to other clinics to get help for their sexual health, because sometimes some of their preferences they may feel aren't what are going with the flow and what are acceptable. So we offer care for everybody. And if you look at our mission, is to champion and celebrate sexual health of all people in BC, and it's to provide care, promote health and teaching, and be inclusive to everybody to make sure that people can access what they need to stay healthy and well.
It's so inspiring to hear about the scope of services Options offers. With such a wide range of sexual and reproductive health care available, could you explain some of the most used services Options provides?
Absolutely. I think the first thing is putting our clients' minds at ease that when you walk through these doors at Options for Sexual Health, you come in and we want you to talk freely about your health concerns. We have people who come in who are embarrassed that they've maybe experimented and done something that they're not used to doing, and they're totally embarrassed. And as I always say, even people who are educated in sexual health will do things at times that, what was I thinking? And that's just part of being human and exploring our lives, not just our sexual lives, but just a part of being a human being. I think for people is to know that they can come in, like I said, to know that their health concerns can be looked after. We're a judgment-free zone. We talk about birth control. What's the right birth control for you? We do counseling around that, and we'll keep trying until we find something that's the right fit for people. The wonderful thing with BC, we now have free contraception. So that's a beautiful gift and long overdue. We offer obviously testing for sexually transmitted blood-borne infections. So that would be testing for like chlamydia, gonorrhea. Sometimes people will come in and they'll have sores and they're not sure, and we'll swab sores if there's things there too to test for that for them. We obviously do cervical screening, which is also known as a pap test, or now the HPV swab that we are doing. We do pregnancy testing. We speak to people about their choices if they happen to be pregnant, and then we give them information to support them and counsel them for them to make the best choice that they can in that moment. And of course, again, I've already said this, so I'm going to repeat it because sometimes we need to hear it all the time, but we hear it for anybody's sexual health needs. So you could be a 12-year-old, you could be 70-year-old, and anything in between, and supporting, our LGBTQ spirited folks as well, that they can come and feel safe.
It's fantastic that Options provides these essential services, especially for people who don't have a family doctor or other healthcare providers. Could you touch base on why it is so vital to have a resource like Options in rural or underserved areas?
This could be a whole other podcast on its own, couldn't it? We really are struggling in our whole country about having adequate health care for everybody, right? And sexual health is an important piece. And Nanaimo Options for Sexual Health see people from all over Vancouver Island. We'll have people who will come in from the East Coast, up from North Island, and even from South Island, because they don't have access in their communities for services. Some people won't obviously have family doctors or NPs there. So if you do have a doctor or an NP, it could take 4 to 6 weeks for you to get in. So if you have an STI, you want to deal with it right now. You don't want to wait for 6 weeks for something else to happen, or some damages that could be happening if you're not treated by it. So it is important to have these hours that we offer for our clinics are usually after hours. So for some people, they may not be able to leave school or get off work to be able to come to the clinic time. So having our hours available in which we are, it makes it easier for people to come in to see and get treated.
Yeah, we learned so much in school about how we can advocate for more healthcare access in rural underserved areas. So it's inspiring to see Options doing the groundwork and really making a difference for people. It's super crucial that Options is bridging that gap. And for anyone who is listening that wants to show their support for Options, what are some of the best ways they can get involved, whether through donating, volunteering, advocating? How can the community play a role in ensuring Options continues to thrive?
First off, thank you, Madison. As the nursing teacher who goes on her soapbox all the time talking about advocacy, I really appreciate this question. And I get a bit emotional because I think quite often we see a lot happening to marginalized populations. And this is one of the reasons I stay working at Options for Sexual Health. So we used to be a clinic that had volunteers helping out with us, but that's no longer the case. In Nanaimo, we have nurses. We have 6 nurses who work, an office manager and a receptionist. And we used to have doctors involved with us, but we no longer have that. So we don't really have much for volunteering anymore. We do sometimes do training for nurses who are wanting to get certified practice to be doing, pelvic health tests and STI testing. So we do have that comes in. I think one thing that we really appreciate, and I think it's common knowledge now that we've been struggling for a few years as an organization, and having people donate, people support us. So if we have clients who come in and they can write, it's all about Google reviews these days. Do a Google review about your experience at an options clinic to help people, because sometimes people do go online and that's how they find out about different clinics. So if we could do something like that, if you want to speak to it. I know recently we've had people in Nanaimo going on to Google and making reviews about our clinic and the service they received. So that would be a way of advocating and shedding some light on our clinics. We do have a charity status, so I can give you that charity number if anybody would be willing to make donations to help support the work that we do. That would be a beautiful thing to do. Making comments, sending letters, sending a letter of approval of what you're seeing in the clinics or the care that you've received, either to our clinic in Nanaimo or to the public or provincial office to talk about it. And I want to go back to that advocacy piece. We had to reach out to the province of BC, whether that's the health authorities and clients and nurses from different areas. And we had beautiful response in the fall and into January that our clinics will be remaining open for another year. And we're working at a game plan to figure out what that looks like. But that came from advocacy. And when we had our meetings, the health authorities were some of the biggest people saying we need to have options available because we can't keep up with everything. And that's, I think, a beautiful piece about Options for Sexual Health. We can offer some of these resources and advocacy and testing and counseling to help people who, if they don't have that in other places, at least they're getting it through us. So that's a beautiful thing.
That's really great to know, Anita. Now we're going to take a short break to hear from my co-host Anna, who has a PSA on a topic we all need to be aware of. Stay with us. When we return, we'll dive back into our conversation with Anita about the important role Options for Sexual Health plays in our community. Stay tuned.
According to StatsCan, heart disease is one of the leading causes of death in Canada. Research from the Canadian Heart and Stroke Foundation and the Mayo Clinic shows that people assigned female at birth often experience different heart attack symptoms than those assigned male at birth. That difference can be life-threatening. We've all seen the classic image of a heart attack, someone clutching their chest in sudden crushing pain. But for people assigned female at birth, a heart attack can feel very different. Instead of sudden severe chest pain, you might feel unusual fatigue, like you just ran a marathon, even if you haven't, a burning or pressure-like feeling in the chest, easy to mistake for heartburn, pain in the back, neck, jaw, or stomach, not just the left arm, shortness of breath, dizziness, nausea, or cold sweats, sometimes with no chest pain at all. A fast pounding or irregular heartbeat, also called palpitations. It might feel like your heart is fluttering, skipping beats, or racing for no reason. You know your body best. Too often, people brush off these signs, assuming it's stress, the flu, or just getting older. But trust yourself. If something feels wrong, listen to it. 1 in 3 people assigned female at birth have heart attack without chest pain. For people assigned male at birth, that number is closer to 1 in 5. That means people assigned female at birth are nearly twice as likely to have a heart attack with no chest pain. The American Heart Association warns people assigned female at birth symptoms are more likely to be missed or dismissed by themselves or even by healthcare providers. Here's the good news. You have power. You can take action. If something doesn't feel right, call 911. Getting help quickly saves lives. Want to learn more? Visit heartandstroke.ca or mayoclinic.org. This message is for education only and does not replace medical advice. Always talk to your doctor if you have concerns. Know the signs, trust yourself, take action, protect your heart.
Thank you, Anna, for that very important information. If you're just tuning in, you're listening to A Sound Constitution here on CHLY 101.7 FM. Now, as promised, we're back with Anita Carroll, nurse supervisor at Options for Sexual Health's clinic in Nanaimo and VIU BSN nursing instructor. It's been a fantastic conversation so far, and we've covered some vital points on how Options is working to improve sexual and reproductive health in our community. Now, let's dig deeper into some of the current trends and challenges we're facing. As mentioned by Rebecca earlier in this episode, recent reports indicate a rise in sexually transmitted bloodborne infections in Nanaimo, British Columbia. Anita, have we seen similar ST-BBI rates in Nanaimo or BC in the past? If so, how were they handled and what can we learn from those situations?
I think STVBIs are going to be similar ups and downs, right? Over the last few years, we have seen an increase in some of the STIs more common. My 30 odd years being a nurse, I've seen very few cases of syphilis, and I've dealt with a lot of those over the last couple of years. It's usually an STI that we don't see very much of with all the being safe and whatnot. To give you an example, like if you look on the BC Centre for Disease Control, anybody can go on there and look at the tracking rates for, it could be anything from pertussis, which is known as whooping cough. It could be for measles outbreaks, which, back east in the States and Canada, there's a measles outbreak. There's something, if we're vaccinated, we've prevented some of that from happening, right? But now we're seeing an increase of people not being immunized and we're seeing these outbreaks. So you can go onto the BC Centre for Disease Control and have a look at these different things to help learn more about it. But specifically, considering the age group of students, roughly, no ageism here, but I looked at the age of 20 to 24-year-olds. And if you looked at that online, female rates of chlamydia for the province of British Columbia, there was 2,639 positive cases. So that's about 15,500 per 100,000 females in the province of BC, and that was in 2020. And then for men or young men at the same age category, there was 1,530 cases. So that's about 865 cases per 100,000. So then when I looked to see what the current stats are for Vancouver Island, looking at some of what those cases were for chlamydia, and this is general, this is not just singling out that age category, but in December of 2023, there was 127 cases of chlamydia on Vancouver Island. December of this year, there was 145, and chlamydia seems to be the more common one that we see, but we also see cases of gonorrhea. And again, in 2023, there was about 29 cases on the island. And for syphilis, 2023, there was 14. That was December of 2023. There was 14 cases. And December of this year, there was 22 cases on Vancouver Island. So you can see it kind of goes up and down with the types of the STIs. But basically, the best way, I'm just thinking about your question, how have they been handled and how do we learn from these situations? I think anytime we have somebody come into the clinic or we're doing teaching with you as a students, or when I think of some of the practicums that were out in schools, I love to be in elementary schools and high schools because I want to teach about this. And if we're teaching about how to stay healthy, this is an important piece. I don't know why there's still so much stigma around sexual health. Many students have heard me say this in the past. If you got bitten by a dog and your arm was cut and open, you go to the hospital, you get it cleaned, you might get a shot, it's a tetanus shot, you get it stitched up and have wound care. If you fell off your bike and broke your leg or your collarbone, which is a common accident for cycling, if you broke your collarbone, you go and get it treated. And I don't understand why two areas of stigma, mental health and sexual health, are still things that are an issue, right? So that's my biggest thing, is how do we educate? And I think if you go back to your question that you were asking, is how can we handle and learn from it? It's talking, it's educating, and removing that barrier of stigma that it's something bad, because it's not.
Absolutely. I mean, we learned so much about advocating for marginalized communities, trying to decrease the stigmatization of those people, try and learn and help in any way, shape, or form. With that being said, do you have an idea or a picture of how public health officials are responding to increased cases of STBBIs in Nanaimo or BC in general?
Well, first off, we are ruled by the BC Centre for Disease Control, and we have guidelines that we have to go by.
Mhm.
Whether you're a nurse working at Options for Sexual Health, or whether you're a practitioner, family practice office, or even like an organization like AIDS Vancouver Island, we all are governed by that. That if we do the testing, then we bring people in and we treat them. Public health does that. We all do that, and it's my belief that we all come from the same platform of wanting to do well and do good for people, so that we would all be doing that. So if we did have a positive case, we would get people in. I know at Options, we get them in that day of the testing, if we can get them with their work schedules and whatnot to have them treated. And I believe all other agencies would be doing the same thing.
It's so encouraging to hear that there's a concerted effort to address this. But like we were mentioning earlier about barriers people face, and particularly for marginalized communities, what are some of the biggest barriers people face when trying to access STBBI testing and treatments?
Oh, great question. I think one of the number ones is feeling judged. A lot of people come in and they're, like I said, they're takes a lot for someone to cross that door to come in for a clinic, and it takes a lot for someone to say, I might have something, I'm not sure, I have this, or it's not going away, and people feel judged and embarrassed. And I think the biggest thing for me is, how do I make that person in that moment feel okay, that we're all human, we all do things at times, we'll make mistakes, and hey, we're here to help you, let's just dig in and get the work done. So I think feeling judged. I think timing of clinics, and of course we've touched on this already, but the lack of healthcare professionals to do the testing is another barrier. Sometimes some healthcare professionals don't feel as comfortable doing some of this work, and sometimes clients don't feel comfortable going to certain people for this testing. So I think that's also a barrier. Sometimes people feel like they don't have the funds that they need to be doing what they need to do if they need antibiotics. And this is one thing that's really important. Antibiotics for STIs in our province are free. If you have a healthcare card, you do not have to pay for antibiotics. I've heard that happen before as well, that people have to go pick them up and pay for them, and you don't need to. If you come to Options for your testing and treatment, we have the antibiotics there and we will give them to you. Sometimes if people are unhoused, they may have lost some of their healthcare information, so that could be another barrier if they don't have their healthcare card. But there are ways that we can find their care number if we need to do that. And I think feeling marginalized, lack of clinics, lack of transportation to get to clinics, and the waiting time. So if you go to a walk-in clinic, you might have to be there at early in the morning to possibly get an appointment. Some doctors' offices are 4 to 6 weeks waiting to get an appointment. So those are other barriers that really impact somebody getting the care that they need.
Absolutely, those were amazing points. There's definitely significant challenges that need to be addressed. With Nanaimo seeing an increase in STBBI rates, especially among younger populations, like we talked about earlier, what are some key points regarding getting tested that you think people should be aware of?
This is a loaded question and a great question. So first off, I think learn how to be safe while enjoying your sexual experiences. That's the first thing. For me, that means having conversations with the people you want to be sexually active with, no matter what scale of sexual activity is. Can you go up to the person you're going to be with saying, I want to have this done to my body, or I want this done. Do not do that. I'm always amazed at how many people come into our clinic who cannot have that conversation with their sexual partners. And for me, that's the biggest barrier. If you can't sit across from that person and say, this is what I want to do, this is what I enjoy, this is a no-go, don't do it, I'm not interested, that is the biggest barrier there. And I think that's where we have some problems from happening when we that. So speaking to those issues, our issues and wants, I think are important. Just going back to your question here, looking at some of the key points about why people need to be tested. So the other thing I would say is, anytime you have a new partner, come into the clinic and get tested. We don't know if somebody may have something might be laying dormant, and someone may not know they have an infection, and it's hard to know. So giving the example of somebody has an outbreak of herpes, right? We have herpes 1 that we usually see around the mouth, and we have herpes 2 that's usually genital, but you could have herpes 2 at the mouth area or herpes 1 at the genital area. They can be in both areas. So somebody may have that and not even realize they had it. Maybe they have not had a herpes outbreak, but they are infected with it, but they don't know it. So they could be shedding the virus, right? And I see a lot of talk on websites and groups talking about, oh, this person knew they had it and gave it to me. And this is an important thing. About 89% of the Canadian population have been exposed to herpes 1 and many more to herpes 2. So that's a big number of our population who have this virus, and they may not even know that they've had it, right? So I think that's a big thing when we're looking at some of the key things and trying to educate people. You can have something and may not be aware of it, and you could be shedding it. So that's why always use barriers, whether it's a male condom, a female condom, or a dental dam for oral sex. Those are important things to do. And I said earlier about making sure that you come in every time for testing, every time you have a new partner. If your partners don't have healthcare professionals, bring them in. Quite often we have people talk about options being just for females, but that's not the case. We're here for anybody and everybody.
All the points you've been making so far, I feel like will really resonate with our young population that's listening. So thank you so
I
much.
hope so. I hope
Yeah.
so. Yeah.
Yeah, so it's so important for people to take these proactive steps. As we wrap up our conversation, Anita, is there anything else you would like to share with our listeners today?
Sometimes people forget, and especially if we're using substances, if we're drinking alcohol, using other substances that might cloud our judgment about things, how some of these sexually transmitted infections are from blood to blood contact, right? So when I talk about syphilis, I talk about hepatitis, especially hepatitis C. Those are ones that can be passed that way. So sharing items, and this is some learning that I've had happen recently. I had somebody come in to the clinic and not being aware of, if you're, for example, out partying on the weekend and you're going to snort cocaine, and whatever implement you're using to snort that cocaine, if you're sharing that with somebody, whether you know it or not, you might be passing on, because you're bursting little blood vessels in your nose. When you pass that straw on, and then you're passing it on to somebody else, they're doing the same, and that's passing blood to blood there. So if that's happening, and people may not be aware, because if you are under the influence, you don't make the best rational decisions at times, right? So and I think the other thing is, if you have something that does happen to you and you think it's something sexually health related, please just come in and ask the questions. Here's another example, because people don't know this either, for testing for herpes. If you have a sore or cold sore, we can swab it if there's a sore there and there's fluid coming out of it. But if it's dried over, we can't do anything about that. We have people come in quite often saying they want blood work, and we can't do the blood work for herpes. But if you have a sore that has fluid coming from it, we can swab it and send that away. So I think little things like that, if people know that, hopefully it will help them to feel more comfortable. And I think as a closing comment is, we're all sexual human beings, wherever you are on that spectrum of sexuality. And if you can just, believe in yourself and look after yourself. And when you're looking after yourself, you're also looking after the people that you are with. And it's just part of your normal health routine. Come in and get tested. If you're not sure and you need to come in a second time or a third time, come in. That's what we're here for, to put your mind at ease. And that if people do have questions or concerns, they can book an appointment to talk to us about any of those things. And go to our website, Options for Sexual Health. We have loads of great resources. A lot of people like to do Dr. Google, but we have lovely resources online that hopefully will put people's minds at ease, and they're not thinking they have something that they don't actually have, because we do have that happen as well. And if you need us, we are open Mondays, Tuesdays, and Wednesdays from 5 p.m. to 8 p.m. And we always have nurses there, and we have an amazing team that work at the front end for us to get people in. But we can usually get you in for appointments within a week. Sometimes we might even get you in that day of. And especially if you have symptoms about something that you need to be treated, we'll definitely get you in. And our number is 250-753-9511. And we are located in the Public Health Communicable Disease building, in the Dufferin Little Plaza Mall at the end of NRGH.
Thank you so much, Anita, for joining us
No
today
problem.
and providing our listeners with such valuable insights on sexual and reproductive health in our community. I so appreciate you taking the time in your busy schedule to have a conversation with me.
Oh, you know what, Madison, you're absolutely welcome. And I love that your students are doing this. It's really important that you are also touching community members who may not have the luxury of going to school or getting to a clinic. We got to talk about some amazing things here, and sexual health is all through the ages, right? So it's a very important one to talk to. So you can reach out anytime. And if any of your listeners need help, please come see us at Options and we'll look after you.
For all of our listeners, remember that Options for Sexual Health is a vital resource, and there are so many ways to support the clinics and stay informed about your own health. For more information, please visit their website at optionsforsexualhealth.org or donate using their CRA number 107-848-269-RR0001. That's all for today's interview, but we'll be back next week with more important conversations to keep you informed. And now, shifting gears a bit, we'll introduce you to a segment called Explaining the Layman's, where Rebecca will break down a term you've probably heard but might not be familiar with.
Hi there, welcome back. Today I'm going to be talking about a medical term that affects many but isn't always well understood. Dysmenorrhea. Sounds complicated, right? But chances are you or someone you know has experienced it. Dysmenorrhea is the medical term for painful menstrual cramps, and it's more than just a little discomfort. There are two types, primary and secondary. Primary dysmenorrhea happens due to normal hormone changes during your cycle, triggering the uterus to contract. It usually starts in adolescence and can feel like a sharp, throbbing pain in the lower abdomen, back, or thighs. Secondary dysmenorrhea, though, is different. It's caused by an underlying condition like endometriosis or fibroids. Unlike primary dysmenorrhea, this type tends to get worse over time and isn't always relieved by common painkillers. So what can you do? For mild cases, heat packs, gentle movement, and over-the-counter medications like ibuprofen can help. But if your period pain is severe, interfering with daily life, or getting worse, don't ignore it. Talk to a healthcare provider. It could be a sign of something more. Painful periods shouldn't just be a part of life. Understanding dysmenorrhea is the first step in managing it. That's all for today's health breakdown. Stay tuned for more, and remember, your health matters.
We've got something fundamental to talk about when it comes to cervixes. For many, cervical cancer can feel like an intimidating and uncomfortable topic. But thanks to a new program in BC, there's a game-changing new way to screen for it. I'm your host, Madison. You're still listening to A Sound Constitution on CHLY 101.7 FM. And I'm handing the mic over to my co-host, Anna, who will be breaking down the new cervix self-screening program and provide you with a vital list of resources for sexual health. Over to you, Anna.
Cervical cancer is one of the most preventable cancers, if caught early. But many people don't get screened because of barriers like access, discomfort, or fear. Well, BC is changing the game. For the first time, you can screen for cervical cancer at home on your own time with a simple swab. Today, we're talking all things about BC's new at-home cervical screening program called Cervix Self-Screening. The information in this clip will be based on information from BC Cancer, the BC Ministry of Health, and the BC Medical Journal. What is this? How does it work? And why is it such a big deal? Stick with us as we break it all down. So before we get into the cervix self-screening, let's talk about why screening matters. The main cause of cervical cancer is a virus called HPV, or human papillomavirus. So what is HPV? Let's break it down in simple terms. HPV is a very common virus that spreads through skin-to-skin contact, including sexual contact. Most people will get HPV at some point in their life, even without knowing it. There are over 100 types of HPV, and most don't cause any harm. In fact, many people's immune system clear out the virus naturally. But some types of HPV can stay in the body and cause abnormal cell changes, which over time can lead to cervical cancer. The good news? We have a way to catch HPV early, before it ever turns into cancer. And that is where cervix self-screening comes in. For decades, Pap tests were the standard way to screen for cervical cancer. According to the BC Medical Journal, Pap tests look for abnormal cells that could lead to cancer. But, as many listeners know, Pap tests require a clinic visit, a speculum exam, and a doctor or nurse to collect the sample. Now, BC has introduced cervix self-screening, a new way to check for HPV directly instead of waiting for the abnormal cells to appear. So, what is this cervix self-screening? According to BC Cancer, this is a simple, at-home test that allows you to collect your own sample whenever you feel safe and comfortable. So it's an alternative to the Pap test for regular cervical screening. The big thing is it tests for HPV instead of just abnormal cells. so we can catch the risk a lot earlier. No speculum, no pelvic exam, and no need to see a healthcare provider. You can do it at home, but if you prefer, you can also do it at a clinic. It's easy and painless and just as effective as a Pap test. If no HPV is found, you won't need another test for 5 years. The best part? It's free for eligible people in BC. Are you asking yourself, how do I get a cervix self-screening kit? Well, I'll tell you, it's simple. Step 1, if you're due for screening, request a kit online at bccancer.bc.ca/screening/cervix or call 1-877-702-6566. No need to memorize this. We'll have this information in our show notes. Step 2, your kit arrives in a plain, unmarked envelope in about 2 weeks. Step 3, follow the simple instructions in your kit to collect a sample. There's visual help on BC Cancer website to get step-by-step instruction on a YouTube video. The test is available in multiple languages and is gender inclusive. If you prefer, a healthcare provider can also assist you. Step 4, mail your kit back the same day you take your sample by dropping it in a Canada Post mailbox. And Step 5, get your results in about 8 weeks. You'll receive them by mail, but they'll also be available online through the Health Gateway. And that's it. No appointments, no waiting room, and no discomfort. So now let's talk about why this is such a big deal. BC Cancer found that many people didn't get screened because of anxiety about the exam, pain or discomfort, cultural reasons, a history of trauma, not having a family doctor, or living in a rural or remote area. By allowing people to screen themselves in private, cervix self-screening removes a lot of these obstacles. This is also a huge step forward in health equity. The BC Ministry of Health reports that self-screening increased participation amongst rural and remote populations, people who've experienced medical anxiety or trauma, trans and non-binary individuals, and Indigenous communities. More people screen equals more lives saved. So finally, I'm just going to cover a couple of common questions and myths. A myth is, if I've had the HPV vaccine, I don't need screening. That's actually false. The vaccine prevents against most types of HPV, but not all. You still need to screen. Or what about someone that says, this test isn't as accurate as a Pap test? False. BC Cancer's research confirms that an HPV test is just as accurate, if not better, at detecting early risk. Another question that comes up is, can I still get a Pap test? Yes, if you prefer a Pap test, you can still request one through your doctor or health clinic. If you have more questions, there's a pretty great list on bccancer.bc.ca/screening/cervix for answers. So I'm just going to go over the information on how to access this test again. We're talking about the BC cervical self-screening kits. If you're just tuning in, if you're eligible for screening, you can request your at-home test today. And like I mentioned before, you can order online, bccancer.bc.ca/screening/cervix. Call 1-877-702-6566. No doctor, no problem. You can still participate and it's completely free. Your health is in your hands. Take the step, get screened, and spread the word. A lot of people seem to not know this has been a change, and the more people that know about cervix self-screening, the more lives we can save. Thank you so much for following along. This is really important stuff. Stay healthy, stay informed, and take care of yourself. Knowing where to find trusted healthcare is key to making informed decisions. In Central Vancouver Island, there are free and confidential services that provide STI testing, contraception, pregnancy support, and LGBTQ+ healthcare. We know this is a lot of information, so we've made it simple. Everything we mentioned today and more is in our show notes and also can be found at islandsexualhealth.org. These services exist to support your health, your choices, and your autonomy. Healthcare should be accessible and stigma-free, whether you're booking routine STI testing, looking for contraception, or exploring pregnancy options. There are organizations ready to help. For example, Women's Vita Clinic in Nanaimo provides IUD insertions, emergency contraception, medical abortions, Pap tests, and immunizations. There's AIDS Vancouver Island, otherwise known as AVI, offers HIV prevention, harm reduction, and support services. Options for Sexual Health, BC's largest nonprofit sexual health provider, offers STI testing, pregnancy counseling, telemedicine support. There's information on HPV immunization, protect yourself from HPV-related cancers, visit Immunize BC for information on where to get vaccinated. All of these services operate confidentially and without judgment. Your health decisions are yours to make, and these organizations are here to provide the information and support you need. And like I said, this and many, many more services can be found in our show notes. Good health decisions start with accurate, evidence-based information. If you're looking for trusted online resources for sexual and reproductive health, check out Sex and You, a Canadian site offering up-to-date, science-based sexual health information, or Need Help Now, a resource for youth facing online sexual exploitation or non-consensual image sharing. There's also Action Canada for Sexual Health and Rights, a nationwide advocacy organization providing resources on contraception, abortion, and sexual rights. These are all linked in our show notes. When it comes to sexual health, misinformation is everywhere. These resources are medically reviewed, evidence-based, and focused on your rights and well-being. Healthcare isn't just about medical services, it's also about supporting people where they're at. Whether you need harm reduction, peer support, or safer sex resources, here are some organizations providing judgment-free services. There's Peers Victoria, a community-based organization offering outreach, harm reduction, and wellness services, including safer sex supplies, referrals, and peer support for those who work in sex trade. Vancouver Island Persons Living with HIV and AIDS Society provides peer-led support for people living with HIV, including advocacy and community resources. Action Canada, which I already mentioned, is a national organization offering resources on contraception, abortion, and sexual rights. It has a 24/7 toll-free resource and referral line at 1-888-642-2725. All of this will be linked in the show notes. So whether you need education, supplies, or connection to a community support, these organizations ensure access to care and resources you need, free of stigma. Taking care of your sexual health is a form of self-care. Whether it's booking an appointment, getting information, or accessing a support service, taking action now puts you in control of your health. If you're not sure where to start, the Sex Sense line is a free, confidential resource where you can ask any sexual health question. Call 1-800-SEX-SENSE, so that's 1-800-SEX-SENSE, Monday to Friday, 9 a.m. to 9 p.m. Your health, your choices, your rights. The support is there, and you deserve care that respects you. Like I said, visit our show notes or islandsexualhealth.org to find the right resource for you.
As we come to the end of our episode, I wanted to give a big thank you to Anita Carroll for sitting down with A Sound Constitution to provide some context for options for sexual health services, STI rates, barriers, testing, and response. If you'd like to know more about options for sexual health clinics or donate, please visit their website at optionsforsexualhealth.org. A very big thank you to my co-hosts Anna and Rebecca for sharing valuable information on STBBIs, endometriosis, PCOS, cervical screening, heart attacks, and providing the listeners with a detailed list of reliable resources. Lastly, thank you to our listeners for joining me today to talk about a subject I care very deeply about. While it was a lot to cover in a short amount of time, I hope it's created a spark of interest about the importance of sexual and reproductive health care. I hope that was as inspiring for you as it was for me. Thank you to our listeners for taking the time to listen to A Sound Constitution here on CHLY 101.7 FM. For details and show notes from today's episode or to follow along on what's coming up this season, check out our Facebook page, A Sound Constitution, our Instagram, CHLY A Sound Constitution, our Spotify, A Sound Constitution, CHLY 101.7 FM, or our YouTube channel at A Sound Constitution at CHLY. We want to remind our listeners that the information presented in this show is for educational purposes only and does not replace the advice of your primary healthcare professional. Thanks again, and we all hope that you have a beautiful rest of your day.